Hi, my name is Ruth Letizia, and I am a general pediatrician in Mesa, Arizona. And today I wanted to talk about the importance of standardized developmental screening. I think most pediatricians think of developmental screening as just part of what we do in a well baby setting. As pediatricians, we're trained to think primarily about things that we can prevent, and we know that early intervention can make significant differences on the impact of early delays that are recognized and treated. And in terms of early intervention, often I think the earlier, the more, the better. And I have always thought that I've been pretty good at picking up kids that were delayed or the kids that I thought we might need to have more close follow-up. So when I first started looking at developmental screening, most of it came from wanting to see if that would be a helpful supplement to my interview and my exam. And also because I was working with some physicians that had varying levels of experience and training, I thought it would be useful to help me keep an eye on how things were working in the clinic and if everyone was on the same page as far as their referral patterns. At the time, we were participating in a quality improvement initiative, and so as part of that, we were coached to develop a policy and a procedure. We worked to develop a workflow and really thought about how we were going to make sure that this didn't affect the office running on time. So when we developed that policy and procedure and workflow, we just used Post-it notes and walked the patient through the clinic and thought about how they were going to flow. We asked our MAs and our front office staff to opine and tell us how they thought that workflow looked, and there was some reshuffling of Post-it notes. But in the end, we had a workflow that everyone thought that they could live with. So we implemented our policy and procedure and started doing the PEDS tool at 12 months, 18 months, and 24 months. Just, a modest attempt in the beginning. And so when we first implemented it, I was mostly looking at the PEDS tool as a way of just keeping an eye on how things were running in the office. But I began to notice that it was really helpful, especially when I had moms that were wonderful mothers, but I think were reluctant to say anything that they would perceive as negative to the pediatrician about their little baby. And so instead of expressing their concerns, they would often speak in very positive and glowing terms about their baby's abilities. And I think that sometimes people feel more comfortable with writing down their concerns than to say them aloud, as if saying them aloud were somehow being disloyal to their baby. So it was really interesting that when I had a child with some mild speech delays, for example, I would review the PEDS tool, and then I would see that this was probably more than I had thought it was based on my interview and my exam. Another way that it was really helpful was when the mom had a lot of concerns, and I looked at the baby and I didn't have any, but I could see that there were multiple small things on the PEDS tool, and it just made me keep a closer eye on that family and on that mom, whether or not that was a little bit of some depression and anxiety in the mother, or whether there was something there that she wasn't able to articulate in words or even express on paper, but there was something that her mother's intuition felt wasn't quite right. I thought that was very helpful. And then finally, the really big benefit that I felt was really with behavioral interventions. For example, if I had a child who was having a lot of temper tantrums at 15 months and we had talked about an intervention, we talked about reading the book 1, 2, 3 Magic, perhaps follow up in a month if you're still concerned. When I would go to record the results of their PEDS tool at 18 months, I would see that I had that observation at 15 months And now here we are with the same concerns. It really made me escalate the amount of support that we were offering mom, helped us think about looking for community resources and supports for kids with those behavioral health problems. And it really, I think, caused those kids to be recognized and to get more support earlier than perhaps they otherwise would have been. I think that the biggest concerns that pediatricians often have when looking at things like developmental screening is how much time is this going to take and what's the cost going to be. Certainly as far as time goes, I think some time spent up front ironing out a workflow so that you can ensure that all team members in your practice have a chance to think about it and to offer their opinions. I think that's really effective in making sure that it's not going to be a big time burden for the practice. And then when we were implementing PEDS tool, it was actually before Access even paid for it. Our clinic's about 50% private payers, 50% access, and we basically broke even. We gave it to everybody, and we got just enough money from private payers to pay for the pads and the screening tools. Now that Access is paying for developmental screening, it certainly is an asset to our bottom line. It's a source of revenue. It's not a big source of revenue, but I think it clearly justifies the time that you take on the front end putting this together for your clinic. So I hope that you'll think about developmental screening and incorporating it into your practice of medicine. I found it to be very helpful, and I hope you do too.